Good afternoon. My name is Charmaine Anderson, Director of Advocacy for Allergy and Asthma Network, and I will be conducting today's webinar in preparation for Allergy and Asthma Day, Capitol Hill, otherwise known as AADCH, on Wednesday, May 8th. I would also like to acknowledge the American College of Allergy, Asthma, and Immunology and say thank you for their continued support. The network is excited about the upcoming event, and we have well over 100 participants registered thus far. So we appreciate your willingness to participate, as we must remain diligent in raising awareness of issues that impact asthma and allergy patients and engage policymakers to move our message forward. Many of you may have participated in this prep webinar in past years. So I do plan to start with the more substantive issues first, and then for our first timers or those wanting a refresher, I will provide information on how Congress works, engaging in social media, and tips for having meetings on Capitol Hill to help support our day. And just here's a highlight of kind of the areas that I will be discussing during the webinar by giving an overview of our policy priorities for this year, diving more deeply into our key advocacy issues for our Capitol Hill Day, really talking a little bit about the federal legislative process and tips for how to meet with members of Congress and staff. I'll talk a little about social media and how you can engage during our day on Capitol Hill and as regards to Facebook and Twitter. Give an overview of the agenda for the day and talk about our advocacy toolkit that kind of gives you all the nuts and bolts and information you'll need to have a successful day on Capitol Hill. What we believe as an organization and our mission and our core belief is together we can work to end needless death and suffering due to, due to asthma, allergies, and related conditions through outreach, education, advocacy, and research. We work to fulfill this mission by engaging with leading experts in building patient-centered collaborative care teams to achieve optimal health outcomes for patients. And the network works tirelessly on behalf of patients so that we can achieve those optimal health outcomes with access to safe, effective, and affordable treatments. And I must say that I am honored I get to work alongside a great team led by our President and CEO, Tanya Wenders, of dedicated individuals who are driven to the core to move our mission forward in the areas of education, outreach, advocacy, and research. And I do want to speak briefly about the primary disease states that we cover. The next few slides will provide an overview of asthma and allergies in the US. And first up is asthma. There are an estimated 25 million people diagnosed with asthma, which includes 1 out of 10 children. This disease has a greater impact on children and older adults and low-income populations, and some ethnic groups have a higher rate of diagnosed asthma, increased hospitalization, and death. Asthma remains one of the most serious and costly chronic diseases in the US at $80 billion annually, with indirect costs including greater number of missed school days and work days each year. Some other key points is a large number of patients do not use their inhalers properly nor adhere to their treatment regimen, and not all patients can afford their medications. When we speak about allergies, allergies affect an estimated 50 million people in the US. The types of allergies include environmental, food, insect venom, medications, and latex. Many individuals are at risk of anaphylaxis, which is a severe, potentially life-threatening allergic reaction. And there are 700 deaths annually due to anaphylaxis, and children and adolescents are most at risk. And when we speak about environmental allergies, the health-related cost of individuals living with an environmental allergy is estimated at $8 billion a year. Also, 2/3 of asthma patients live with environmental allergies, and the odds of a child having an allergy of some sort increases if both parents have allergies. In regards to life-threatening allergies, there are millions living with a life-threatening allergy, and cost to our healthcare system exceeds $24 billion each year. 1 in 12 children have food allergies, and nearly 30% of children with a food allergy has asthma. One thing to note, 25% of food allergy reactions occur in children without a previous diagnosis. Death does occur to those who live with life-threatening allergies, and most often it is due to the delay in the administration of epinephrine treatment in an emergency. Talking about our 2019 policy priorities, these are priorities that are set by the organization each year that really helps us move our way of dealing with policies and regulations and resources that we feel are needed to support patients and families living with allergies, asthma, and related conditions. For 2019, these issues include access to safe, effective, and affordable medication and treatment options, access to affordable and high-quality healthcare and insurance coverage, funding for allergy and asthma health and research programs, access to innovative therapies and technologies to advance medical treatment, mitigating environmental health hazards, ending health disparities and moving toward greater health equity, and modernizing food labels to include sesame and cross-contact with food allergens. Our key AADCH advocacy issues align with the network's 2019 policy priorities and our current engagement at the federal level. And here's what your members and their staff need to know. First up is access to care. Access to health care results in successful health outcomes for our patients, whether through government programs, including Medicare and Medicaid, innovative therapies and technologies, or in our schools. All are important to address specific medical needs and improve patients' lives. We are making recommendations to maintain adequate coverage for individuals who rely on Medicare and Medicaid, as well as individuals with pre-existing conditions. Implementation of school-based health management programs, which include medication access in school through stock programs and utilization of asthma action plans, transparency and a clear appeals process for medications subject to step therapy, and the use of telemedicine technologies to provide care, respiratory care services. Secondly, under affordable medications and treatments, with the rising cost of prescription drug prices, Americans are at risk for poorer health outcomes, especially those with chronic and life-threatening conditions such as asthma and severe allergies. We are making recommendations for the reduction in prescription drug costs for patients, as well as out-of-pocket costs for low-income seniors who rely on Medicare. We want to see improvements for access to generics and biosimilars in the Medicare program, and we want to see a separate billing code and reimbursement in Medicare for each biosimilar biologic product. In regards to asthma and allergy federal funding, federal health and research programs are essential to improve the healthcare quality and safety for all Americans. The development of new treatments and best practices in care and providing patients with healthy and safe environments are just a few of the program areas essential in supporting patients living with a chronic illness. Our recommendations to Congress are to continue federal funding in the upcoming fiscal year for asthma and allergy research, education, and outreach initiatives at the CDC, at NIH, with HUD's Healthy Homes program, as well as EPA's asthma research, education, and outreach initiatives. In regards to health equity, we find health disparities, whether that be access to care, poverty, environmental hazards, education inequities, language and cultural differences, cross ethnic and socioeconomic groups, and impact individual health and well-being. And to support better health outcomes for patients, the development of more programs, services, and policies are needed, where all populations have full and equal access to opportunities that enable them to lead healthy lives. We are making a recommendation for the development of health equity interventions to support better health outcomes for patients in the areas including the environment, whether it's indoor or outdoor, in transportation as it relates to access, through education, and even dealing in the language and cultural aspects. For food package labeling, we're really focused in the world of sesame. Nearly 32 million Americans are living with a food allergy. and sesame allergy has increased in recent years, due in part to the growing number of products containing sesame seeds and sesame oil, including foods, cosmetics, lotions, and pharmaceutical products. Exposure can lead to a severe or even life-threatening allergic reaction. There are 8 major food allergens, including milk, egg, peanut, tree nuts, soy, wheat, fish, and shellfish that are represented on packaged foods in the US. Sesame is not recognized as a major food allergen in the United States, unlike Canada, the European Union, Israel, Australia, New Zealand, and many others. There's also an issue of unintentional cross-contact with a food allergen, which can also occur during food processing by a manufacturer, which can cause an allergic reaction. We are making a recommendation that the Food and Drug Administration, otherwise known as the FDA, should require clear and consistent labeling of sesame in foods and any potential for cross-contact during food processing. And to kind of go a little bit into the federal legislative process, because it's one thing to have an idea and want to see that idea turn into an action item and further into policy. It certainly requires the movement of a bill in Congress. So I'm going to touch on how a bill becomes a law to give some of you all a refresher, some of you all an education lesson on really the ins and outs of how a bill becomes a law. The process of a bill becoming a law begins with a member of Congress, whether that be in the US House of Representatives or in the US Senate, where they introduce a bill that is assigned a bill number, starting with HR if it's by a House member, or an S if it's by a Senate member. If a bill has passed in both the House and the Senate and has been approved by the President, or if a presidential veto has been overridden, the bill becomes a law and is enforced by federal government agencies. Procedural elements are built into this process for both the House and the Senate to weigh in and make any changes to a bill during various committee meetings, whether it be at the subcommittee level, the full committee level, and or in a conference committee where both the House and Senate come together prior to a final vote on a bill. And I want to bring all this to your attention, and here's kind of an infographic that kind of gives a showing of when that bill is introduced and the committee action that's involved and where the House and Senate come together to vote. The conference action is where both the House and Senate come together to iron out any differences, and then the bill is presented to the President for signature into law. This is important to note. There are a couple of bills that are currently in Congress that are pending that we are supportive of. You will see one thing to note, the bills that you see, and I apologize, this might be in smaller print, but I wanted to make sure I put it in part of this presentation. The bills that do not have an actual bill number are spending bills. Bills to fund the government originate in the House of Representatives, and the spending bill gets assigned a bill number after the full Appropriation Committee considers the bill and before it gets sent to the House floor for consideration by the full House to vote. So in addition to these spending bills, which fund CDC and NIH and the Department of Housing and Urban Development and the Environmental Protection Agency, there's 3 other bills that are very important to us, and I'm sure there'll be others probably by the time you all get here on May 8th that will be part of this list, one of which deals with climate change. And specifically this bill directs HHS to develop a national action plan in order to help health professionals prepare and respond to public health effects as it relates to climate change. And it also encourages further research and stakeholder collaboration. The next bill is called the FASTER Act, is the acronym, which will require sesame to be added to the list of allergens by the FDA, and also deal with the cross-contact of allergens, and also deal with CDC and direct them to do more data analysis in regards to the prevalence of food allergies. Last but not least is a new bill that was just introduced called Safe Step Act, and that deals with step therapy. And if you're not familiar with the term, step therapy is a process by which that insurers use to limit how much a patient can use or it limits how much they can spend on certain medications, my apologies. And under step therapy, patients must try one or more drugs chosen by their insurer, usually based on cost, before coverage is granted for a drug that's been prescribed by a patient's healthcare provider. This bill will allow for more transparency in that process as far as what types of drugs are being prescribed or that the patient has to use, but then also provides a clear process for an appeal for the patient. So thereby they can override the decision of their insurer. Next up, tips for meeting with your members of Congress. I will say just on the onset that, as much as we try to get meetings with members of Congress, obviously their schedules kind of dictate if we're going to meet with them directly and or with their staff member. It also dictates the location of the meeting. Oftentimes members will have meetings kind of where they are at the moment. It's not necessarily in their offices. It could be in the Capitol, it could be in a conference room or the like. So just be flexible in the day. There oftentimes is limited space in members' offices, either again, whether it's in the office of the member itself or in a hall or in a small room. The other thing to take note, there is a lot of walking involved. Our scheduling company is trying to work so you're not kind of having to crisscross across the Capitol, multiple times, and you kind of stay put in certain periods of the day. I would advise to wear comfortable shoes because there is a lot of walking. And then also at the onset of your meeting, please ask staff how much time you have, particularly if there's a member in the meeting. Oftentimes members when they're in session, there are votes that they have to leave and go to the Capitol to vote. And they too walk oftentimes to get to the Capitol. So there's just a time perspective there to be mindful of. As it regards to just having a meeting and conducting yourself in one, first off, introduce yourself. We will be providing you with information to give and provide to the member and their staff member in a folder, which will outline our key issues, among other things in the folder. So that is something you will quote unquote leave behind for the member and their staff. So you'll be describing the issues that we just chatted about earlier during this webinar. And most important, as much as we kind of give you our sense of the issues themselves, we certainly want you to add personal anecdotes. The most important thing you can do when sitting in front of your member of Congress is to really talk about how issues impact you personally and or someone you know. It really kind of gives that personal experience, and the members really gravitate toward hearing and learning more, and they can make a greater connection with the issue, the bigger issue, if you can provide that personal anecdote. More importantly, stay focused, keep the conversation simple, be very polite, show openness, because oftentimes members of Congress, if they do have questions, they can come in at you with a counter argument and ask more deeper questions as to the why, or I don't want to support. And the biggest, my lasting moment in that regard is just to ask for them to explain the why if they're not supportive, so we can then gain a greater understanding of really what the issue is as to why they're opposed on something that we are supporting. Also, we're again asking the legislator to take specific action. Those recommendations that we have presented, those are certainly ones we would like you to express to the member, but more importantly, that list of bills that I have provided, we're going to be asking the member to support that list of bills. And again, it's something where you won't have to necessarily know a lot about. We'll have it in that spreadsheet or that table format. So it's just something you can provide and hand to them and ask for their support. Certainly offer to get answers to any questions you don't know. That's kind of where us at the network kind of come in on the back end, and we'll do follow-up meetings to make sure that any questions that were presented to you that couldn't get answered, get answered. Toward the end of the meeting, please summarize any commitments that the member or staff made. If they did say, yes, I'm supportive, please make a note of that. Ask when and with whom you should follow up. If there is follow-up, oftentimes the member will ask you to direct any follow-up questions or things of that sort to their staff member. And I will say all members, at least from the time that I've been doing this, will be in the same room with a staffer who will be the one taking the notes. So again, just make sure that you get a card and make sure there's follow-up. Say thank you. We certainly would love for you to take pictures. Members love taking pictures with their constituents. And certainly we encourage you to post those pictures on social media. We do have a hashtag, AADCH 2019 for our Capitol Day event. So any pictures or social media that you do utilize, we ask that you use that hashtag so we can keep track of all the wonderful things you'll be doing on Capitol Hill. And to that point, my light bulb moment, just to be sure you include your members of Congress in any social media posts, and particularly because many of them and their staff will retweet and or repost any messages you have put out there, particularly if their name is attached to it. And oftentimes they too can gain even more support for an issue that we've put before them. In regards to social media, we found social media platforms such as Facebook and Twitter to be very effective outlets to reach our target audiences with news and information, and are useful tools when members and staff take note, and oftentimes will respond directly within a post, like a post, or even share your post to others in their network. We will provide sample tweets and Facebook posts for you to use to amplify AADCH 2019 during your time with us in May. And we encourage you to publicly share your experiences and advocacy messages online during and after AADCH. So in regards to just social media, again, we really use a lot of social media platforms in regards to Twitter and Facebook. We're moving into the Instagram world also, but for all intents and purposes for this particular day, we're going to be utilizing Twitter and Facebook. And as I mentioned earlier, members of Congress do use social media to spread awareness about issues they care about. They update their constituents on events happening in their districts, whether it be a town hall meeting or other type community events. They do discuss public policy in regards to these social channels, and they highlight organizations or constituent groups they meet with. So again, if you're savvy enough to utilize these social media channels, we certainly encourage it. In regards to Twitter, and just a couple things to highlight, we do have our own profile on Twitter for those, again, you are comfortable in the Twitter world, which is twitter.com and then Allergy Asthma Headquarters. Again, reminding you that Twitters or tweets are restricted to 280 characters. You certainly can send us messages via Twitter and at the @Allergy Asthma Headquarters. And again, reiterating the hashtag of hashtag AADCH 2019. Each elected official does have a Twitter profile where you can tweet advocacy messages to them. And you can find tweets from yourself and others by searching for topics utilizing the hashtag and or keywords. And again, here's just an example of a tweet that can be sent. I gave an example of the chairman of the House Energy and Commerce Committee, Mr. Frank Pallone from New Jersey. His committee pretty much has a lot of jurisdiction over the healthcare related bills. Funny you should say, why Energy and Commerce Committee, but within the Energy and Commerce Committee is the Health Subcommittee, which really deals with the health policy issues for the House of Representatives. So again, if we wanted to send a message to Mr. Pallone, who again is chairman of the House Commerce Committee, Energy and Commerce Committee, we could do so. If you can see the sample tweet that I provided that utilizes his personal tweet or Twitter name, again, the Twitter name of the committee, and then ending it with the hashtag for our event. Again, so we too, as a network, can see where messages are going and if there's been a response by the member. Facebook, I'm sure most of you online are familiar with Facebook, particularly because it is so easy to connect and share information. We do have a network Facebook page, which I've outlined here. You can certainly tag us in any of your posts by utilizing the @Allergy Asthma Network. And then again, any type of hashtags you use, can be utilized on Twitter in addition to your Facebook post. And again, here's an example of a Facebook post that could be used. And again, as I mentioned, we will be providing a list of sample posts for both Twitter and Facebook that highlights some of the issues that we are up on Capitol Hill advocating for. That will be posted on our website, so you can utilize that, and we'll also have that available in the folders that we give to participants when you arrive on May 8th. Wanted to briefly touch on the agenda for the day. It is a long day, so certainly we ask that you don't miss breakfast. We are starting promptly at 7 a.m. We will be sitting according to your state. It does help our scheduling company identify which tables are which as they start to hand out the schedules, the hard copy schedules, and or if there are any questions. The breakfast briefing will also have speakers, which will include our President and CEO, Tanya Winders, Dr. Michael Bowman, who is with the association, or past president of the Association of Asthma Educators, yours truly, myself, to speak about, just kind of go over our key issues. We'll hear some patient testimonies, and our scheduling company, Soapbox, will be there on site to answer any questions and make sure you're comfortable and all things are a go with your schedule. We will have Capitol Hill visits from 9 to 5 that day. And again, we have over 100 people coming. So our scheduling company certainly has identified which states are represented. We've made sure that, those meetings are being scheduled with your key members. We do have a number of folks who are coming representing the state solo. So we certainly don't want you to have to go around by yourself. So we'll be sure to either connect you with one of our staff members to attend meetings with you, and or join you with another state where perhaps there is also a single person but maybe more experienced in the Capitol Hill event. From 12 to 1, we will have a congressional lunch briefing where representatives from the Congressional Asthma and Allergy Caucus will be there, and or their staff, patients and families. And those of you who do have that window of time on your schedules to join us, we'll have speakers also, which will also include Dr. Todd Mayer, I apologize if I'm mispronouncing that, who is the president of the American College of Allergy, Asthma, and Immunology, Dr. Leroy Graham, who's the founder of Not One More Life, and a member of the Board of Regents for the American Thoracic Society. And again, as I mentioned, we'll also have some patient testimonies, and lunch will be provided. It's a bag lunch, and it is free. Last but not least, at the close of the day, we'll all return back to our host hotel at the Liaison for a wrap-up to, again, speak about kind of an overview of the day. We'll have a presentation by the Environmental Protection Agency. They will be presenting the annual EPA National Environmental Leadership Award, which are awards that go to asthma management programs around the country, and I believe there's 3 that will be given that night. And certainly I want to make mention too, which will provide more information, but those of you that are traveling to Washington and arrive the day before, we will be having a small informal gathering at the host hotel just to kind of meet and greet. We will identify the time and make sure we push that information out to you. So certainly you'll have an opportune time to meet with us prior to the day's event the next day. Last but not least, I do want to touch on the advocacy toolkit. This will be made available on our website. And within that toolkit, there will be the agenda. As I mentioned, individual meeting schedules will be provided separately. Soapbox will be emailing your individual schedule on May 3rd to all those who have registered and accepted the wanting to have meetings. It also will include the advocacy issues, which are currently already posted on our website. I am developing talking points to help kind of gear the conversation when you're in your members' offices. There are meeting tips that are listed are posted on the website. Again, gives a little deeper dive into kind of how to have a meeting with a member of Congress, just so you're comfortable. We will be providing the social media examples for Facebook and Twitter. There is an outline of the Capitol Hill map, so you kind of see where the buildings are. And just so you know, for frame of reference, the Capitol sits in the center, and the House of Representatives are on one side of the Capitol, on one side of the street, and all the Senate buildings are on the other side of the street. So it kind of gives you perspective of just the two bodies in Congress. And then last but not least, I wanted to touch on the virtual advocacy, which this will lead to another function on our webpage, where those who cannot participate in person coming to Washington, D.C., they can be at home sending messages to their members of Congress via letters and or emails while we are on Capitol Hill, still presenting the same messaging, but it allows them an opportunity to participate from home. Because again, the louder our voices are, the more traction we can make. And we certainly want to get to as many members as we possibly can. Again, all our materials will be available on our website at www.aadch.org. I want to say thank you, everyone, for your continued support. And those of you who this is your first time, we certainly appreciate you having the desire to come to Washington and support patients and families living with asthma and allergy and related conditions. I certainly, too, personally appreciate all the help and work that's gone into this event, and more importantly, your participation as one who's lived with asthma my entire life. So again, thank you, and I will look to see if we have any questions. Well, I gave a great webinar because I do not see any questions. Certainly, everyone that's on the line knows you certainly can email me if there are questions between now and the time of the event. I will be here at your disposal. And again, please check our website periodically for more information. We will be providing more email information as well in the coming week. And I just got one question popped. It says, what will the dress code be? Great question. I apologize, I forgot to even mention that. It is, I would say, comfortable and more, I would say more business casual and or business. I certainly would not wear jeans, although again, as a constituent, they're a little more comfortable kind of you coming as you are, because truly we have tourist groups that come to Capitol Hill. But for the sake of representing the organization and being, you know, kind of going in as in a meeting to meet with your member of Congress, I would certainly say business casual is certainly more than fine. And again, I want to reiterate to wear comfortable shoes. I'm seeing, what are the prospects for improved access to generic epi and meds legislation passage in 2019? I do not know the answer to that question. Certainly, I know with the heightened, sentiment in the country about the high cost of prescription drugs in general, whether that too takes a turn and adds to the element of just the types of generics that are available for patients. Just the outlook on looking for improved access to those types of generic medications, I would say maybe more promising than not, just again, as it relates to cost. And I think that's it. Again, please reach out on email. I'm here if you need any questions answered, and we'll be getting more information out to you. Thank you again, and certainly we appreciate everything that you all are doing, and we'll see you on May 8th. Thanks.